program. As in the past, I brought a number of guests to the studio to talk about what they do, why they do it, and how it would benefit the Wakefield community. Today, such a guest is with us. Her name is Tammy Jamieson. Tammy is the president and CEO of Health Alliance. And she also has developed a technology which I think will be beneficial to our community. And Tammy, thank you for coming on the show today.
Thank you for inviting me.
The purpose of coming on is the fact that Tammy has some information about medical technology. It's a field which is advancing very rapidly today, and I thought that what she is doing would be of help to our community. Tammy, let's talk a little bit about your company, how you got it started, and what would be the benefit to our community.
Excellent. Health Alliance is really all about getting individuals, patients, if you will, involved in their health care. And we want them to understand that it's very important that they become active custodians in managing medical information as well as the procedures and treatments that doctors have requested them to follow. One of the things that Health Alliance has been very proactive in is driving information to become knowledgeable for collaboration in the care of individuals. We don't want patients to have to remember everything that goes on about them and to be the knowledge base of their care, but we want doctors to make their information available to other doctors that are caring for the same patient. So we're extremely oriented around the patient, and we strongly believe that it is the care of that patient and the way that they're managed that becomes very important, and we want them to understand.
Now, you developed this technology based upon what? I mean, you were dissatisfied with the way the medical records were being transferred or managed. I mean, that's a problem today, and so with your technology, you're going to address that issue, not only for the patients, but with the medical community as well. Is that correct?
Yes. What we have found through experiences, just regular patient experiences that individuals on our team and also myself, we found that medical information was very valuable. Unfortunately, it was not making it from one medical visit to another medical visit surrounding the patient. We found that patients had procedures that were done, images, lab work, that would stay with one doctor in his file, but didn't make it to the next doctor so that that doctor could collaborate around the patient care. So that's something that we've worked to resolve.
So how did you address this technology? How does this kind of work so that the public understands what it is you're doing for their benefit?
Well, one of the things that we found is a twofold situation. We needed to have the technology that allowed the information to be at the point of care. That was one of our first issues that we needed to tackle. We also found that in order to ensure that the patient had comprehensive information, that we needed to provide a service to also help that patient get their medical information, because sometimes it's difficult for patients to ask their doctors for medical information. So we kind of act as an agent on behalf of that patient to gather their information and then to give them the technology to grant access to their medical and their health information.
So this information you get from doctors, from the medical office, we'll say, this would include x-rays, notes, whatever other medical procedures you may have had, and you'll be able to capture that in one custodial spot that will be available to the patient or to the patient's other doctor, and all the records will be contained in one location. Is that correct?
Absolutely. And it is very important to gather all of your medical information. And as you pointed out, the medical images, the lab work, procedures that have been executed, tests, surgical notes, anything that has occurred and been recorded about that patient, as well as the patient's health information. What is the patient doing at home? What kind of dietary programs are they on? And the patient gets to become active in recording that information along with the doctor's notes, which we gather for them.
So the patient could be traveling someplace out of the state, and in doing so, if something happens, they'll be able to pull out something like a credit card, and on that card, it'll indicate to the doctor, if they went, say, insert that into the system, all the medical transactions that you've had over some period of time.
Yes, we have what we call a key, and that key is given to the patient, and it is flash device that the patient gets to carry. They become the ones who give that key to the medical provider at the point of care, and they grant the access. Health Alliance never releases any information. We just make it available and we gather it. And we hope to get patients at a very early age so that we carry the cradle to grave situation of all of their medical and health, and that becomes available at the point of care.
That's terrific. One of the things I can see as a problem where you get students who come here outside the country and they don't recall exactly what their prescriptions were for drugs, you know, if they have some type of allergy, what have you. And on this record, if they were to subscribe to the service on this technology, you would have the prescribed medications, how often they should be taking, et cetera, et cetera. I'm just giving you a simple example.
Yes.
There are other examples, especially when you talk a little bit about elderly parents.
Two great areas that we like to bring value to, and that is, as you pointed out, the college student. You know, these are individuals that have turned 18, now need to become responsible for themselves, including their health care. They haven't been involved in that to date. Now they're being sent away to school, if you will, and we want to provide our technology should anything happen to that student while they're at school. Another very important area for us to assist in healthcare is with elderly individuals. And for that sandwich generation, the 50-year-olds, if you will, who are managing their parents' care, is to be able to make sure that the information about all the medications, all of the treatments, is there for a doctor to see the full comprehensive information. It's often that elderly individuals forget the number of medications they're on, as well as the milligrams and dosages in which they've been prescribed. So we want to make sure that all of that information is available.
I think that's a very key point because many of us today have responsibility to manage our own parents. If they get sick or they get confined to some location where they don't have access to their records, and to be able to have this information available to help manage their health is critical today. And more of us are getting involved in those kind of situations than ever before. So that is very, very important.
Yes, and there is a huge contingent of individuals who do sit between either their children that they're taking care of or their elderly parents, and it becomes more difficult to keep track of who has what medications and illnesses and so forth. And so this is a definite technology-enabled service that will assist them in taking care of those people.
Let's kind of jump into the parents for a moment now.
Yeah.
We've talked about the children in college, we've talked about their parents, but now you're talking about the everyday person. How are this going to benefit the everyday person relative to their health, their records, and health records, as you know, is a big issue today. And how are you addressing that with your technology?
An interesting thing is most individuals who commute to and from work leave their local community of medical providers. If you were to be here in Wakefield and you commuted to Boston and something occurred while you were in Boston at work, you were already outside of your medical community. You're going to be taken to hospitals and physicians within that area who don't know anything about you. Health Alliance is going to make all of the medical information and health information that you've had from your local community to be reviewed and understood and giving knowledge to those doctors in Boston. So it's something that becomes very important in making sure that the right allergies are understood, the right medications are understood, everything about you that's going on is available so that the right diagnosis is given to you and very quickly, effectively, and efficiently you're cared for.
And what's really important, let's say something that happens, you're outside your regular community, you're now in another situation, and if an accident does occur, you're generally panicked and you don't remember all of these things. So to have this type of technology available to you or to members of your family is extremely important. And I can't talk to you enough about how fabulous this could be. Let's even extend this a little bit further on the same theme though. We're such a mobile society, so now you're not here in the local community, you're out in Colorado, you're on vacation, or you're elsewhere in California, or down in Texas, in Florida. What can they do based upon
Yeah,
your
and
technology?
you know, one of the big points that we like to get across to individuals is that there needs to be a collaboration about their care. And medical providers need to collaborate with one another about caring for this patient. So as they travel to a state such as Colorado, if something occurs, those other doctors who have cared for you are able to give the information that they've gathered over the years of caring for you to the doctors that may need to have an immediate situation while you're in Colorado. That creates a collaborative approach to an individual's care. It hasn't been that way in the past because doctors are not at every incidence that we have, but we want to bring that collaboration under the use of information technology.
So even if the key was not available on the person, the medical community, wherever you are, would have access, given your permission, to your medical records based upon
Yes.
our technology.
Yes, Health Alliance has a comprehensive patient-centric repository that can be accessed by any authorized physician. Whether the patient has the key or does not have the key, we can assist with getting that information to the caregiver or the medical provider.
Well, as a startup company, let's talk a little bit about so there's someone out there thinking of starting up their company. What are some of the issues that you face and how are you addressing them today?
Health Alliance, as all software technology companies, has had to build a product, and we've spent a tremendous amount of time making sure that we understood healthcare, where the issues lie, understand why there's data fragmentation, information that is spread out everywhere about the patient, and how we might bring value to each of the three entities of healthcare, which are the patients, the medical providers, and the insurers. And we felt that we needed to work and collaborate with each one of those groups. One of the difficult things is, as you go through that process, it takes some time. And a company such as ours requires funding, and that's been a challenging thing for us to go through, especially in the present economy. And that's something that we're constantly working on and looking to find the right individuals to help us move this product forward.
So if someone wanted to help you with the funding, I mean, there's an email address at the end of this program whereby you'd be able to get in touch with Tammy and talk to her about it and see where it goes from there.
Yes, we would love to talk to patients, medical providers who are interested in our solution of solving this fragmentation issue, insurers, and definitely funding individuals who are looking for innovative technology that really solves unique problems in today's healthcare.
Well, in the brief time we've been here, we've talked about teenagers in a way. We've talked about their parents, the parents' parents. Let's kind of shift over a little bit to the medical community. What's the advantage of your technology to the medical community?
One of the things that, again, we want to make sure that a medical provider has, a doctor when you enter their office for the visit, is that they have a knowledge of information about you so that they can give you personalized care. That is one of the main things that we think that we can assist physicians with. Typically, individuals don't go to the same doctor over the span of their life due to insurance changes, moving, relocation, employers, etc. There's a tremendous number of issues that drive individuals to finding the right physician. And as that physician cares for you, they need to have a full understanding of what's gone on, all your vaccinations in the past, all your allergies. What are you doing within your home to take care of yourself? Vitamins, dietary supplements, any of those things need to be presented. And typically, patients who go into these visits are a little nervous. They have approximately 18 minutes for that visit.
Get their case
and for
across,
them
yeah.
to get the message of what their issue is and all of their past care to a doctor very quickly, and the doctor can make a quick diagnosis, becomes very difficult, both for the doctor and for the patient. So we want to help alleviate some of that stress that goes on in that event so that the doctor has a clear understanding of me without me trying to remember all of those things as a patient.
Yeah, sure. I mean, not everybody is in a large medical complex.
Yes.
And by having this type of device, the information is available, it's consistent, and you can add to it. And so I think it will be very beneficial to both the doctor as well as the client, as you explained.
Yes, and helping doctors get to a better diagnosis more quickly, effectively, and efficiently helps them as well. They're able to make sure that they're bringing the right care to the patient and that the patient feels good about the visit. Not that they had to come in and try to remember every symptom at that moment or every medication and its dosage and how often they're taking it. That just makes patients nervous.
Sure does.
So we want to alleviate some of that stress.
Well, one of the things to consider is the fact that one of the largest costs in the medical profession today is the duplication of tests. So
Yes.
let's say you're here in this area and you go elsewhere and you've had an MRI, let's say a month ago, and all of a sudden something happens where you're down in Florida, and all of a sudden they say, well, I want to give you an MRI. You don't have to do that because with your technology, that record, that information, that medical, the MRI test is on your record.
Yes, and we want to alleviate the redundancy. It is very costly for health insurance, medical providers, and patients to cover that redundant cost. There's needs to have timely information, but there doesn't always need to be a case of redundancy. And so we want to alleviate redundancy. We want to alleviate fact-finding tests and procedures. Those can help lower the cost of healthcare. And also the big thing that drives medical costs up are errors. And most medical errors are due to a lack of information. Doctor didn't know you were on a certain prescription. He prescribed you to a medication that may have an adverse effect to the first medication. So we want to help alleviate those costly things.
And that's a great idea because many times you go to another doctor, another medical facility, and they ask you a question, and you just say, hey, it sounds like it's a good idea to me. And when in fact you don't need that because they can draw the same information off of a previous test you've already had. It lowers the cost, gets the information to them right away, and it's time saving, which I think is great.
Yes, and along with being able to get that information, hopefully you're getting better second opinions. Doctors are looking at the first opinion and now are able to make a better second opinion. So we think we can collaborate on that level as well.
I think that's great. Let's step into one other facet of this, the advantages of having this type of technology. Let's talk about the insurers. What benefit would this technology do for insurers?
Well, one of the things that insurers have a very difficult time is understanding evidence-based medicine. Often they look at the cost of a particular procedure and try to determine if it was effective. If we could help drive information from evidence-based, what were the symptoms at the beginning of the event? How were they tested? Were the tests proper? What were the procedures that were followed to solve the symptoms? And then what were the long-term outcomes? Then insurance companies can look at this timeline and decide whether ensuring certain procedures and tests and so forth become effective. Instead of just looking at the short term, it costs this amount of money, we don't know the results. We want to bring value to that, and we think that insurance companies can lower cost and yet make better policy decisions. We also think that we can help them in understanding some of the things that are going on with the patients that they're insuring and how they might be able to drive better managed care programs to assist those patients.
Now, these seem like all good ideas. Do you think the insurance industry or even the medical profession would be advocates for this type of technology?
I believe they will be. And one of the things that we're seeing is that under the last two presidential administrations, that there has been a strong push for the government to assist physicians into making their information electronic so that it can be used at various medical events that the patient goes to. So we know there's a large push there. We know that doctors want to find more effective and efficient ways to care for their patients. So if they have that knowledge base of information, we believe that they will want to utilize that to help and make the patient have better outcomes. The insurers are looking at continually finding the best effective way to cover the costs of their patients without doing anything extraneous, causing extraneous costs. So we believe that all three of these entities are very interested and need to get involved in trying to drive these costs down through information.
Now, this technology would be good as well for, aside from medical coverage like Tufts, Blue Cross Blue Shield, etc. Life insurance or investment firms, will they find some benefit in this?
Yes, life insurance companies would have a better understanding of the types of issues that individuals go through, will better understand how they should set those policy premiums. The other major thing that we want to assist in is understanding where we might be able to support those managed care programs and how insurers can get information to the patients so that they can help drive down the costs as well.
Well, that's great. What about someone who is in a nursing home? We talked about just list briefly, but talk about from a parental perspective. How would you take a look at if your parents are in a nursing facility or in some other similar location? How does this help them from your perspective?
We are very valuable in skilled nursing facilities where an individual is being cared for from a minimal standpoint. Typically, there is not a doctor on staff, but the individual has a nurse or nurse practitioners who are available. If the patient has a serious illness, typically, if it's during the evening, typically they're taken to the emergency room. And the travel between those two facilities sometimes creates data fragmentation. So the medical record doesn't always travel with the patient. They often don't have all of the information at that point of care. So we can bring value to that mother or father who's being taken from the skilled nursing facility to the hospital for maybe a serious issue.
That's terrific. How do we share this information amongst other family members who have a need to know? I'm not just talking about the parents, but I'm just saying outside the family unit, but relatives of yours or your children. And how do you address something like that? And what would be the benefit of doing something like that?
Yeah, that's an excellent question, because one of the things that we've spent a tremendous amount of time in understanding is how we allow family information to be shared, family medical information to be shared. We want to make sure that the patient is the one who grants access to other family members. Once they do that, we want to make that medical information available so that if a physician asks a question about a parent, for instance, my parent, that they are able to look at those medical records of the physicians who cared for my mother or my father. I don't give them a non-educated answer and hope the doctor fully understands. I want them to see the actual medical diagnosis of the illnesses or injuries that my parents have had. Health Alliance has some very unique and proprietary technology that supports that sharing of medical information amongst family members.
Well, in a lot of instances, people don't realize that the genetic connection within a family, they talk about it, but they don't realize from a medical perspective what that can do from, let's say, your sister, your brother, their children, and other relatives, and how if you pull all that information together, the benefit to be derived from a family perspective is tremendous, is it not?
Yes, it is. I mean, we're all headed towards the study of genomics. We want to understand the genes in your family tree, if you will, to better understand what we believe will happen with you as a patient. And so Health Alliance has built the infrastructure to support that information. Again, we'll turn to the medical community to certainly do the genomics and the study of genomics. But in order to gather that information, we want to be able to make it available and drive the information that helps medical providers understand what may or may not happen to that patient based upon their family tree.
Well, medical records, the transition of medical records today is such a disparate activity that it seems to me that your technology is really ahead of the game. And I think the benefits to be derived from the people we talked about, teenagers, parents, grandparents, You know, even people in business who need to get medical information, but also the transfer of information or the transmittal or sharing of information amongst family members could, yeah, those people could all derive the benefit of your technology. I think this is terrific.
Yes. And, you know, we want to make sure that it's not just a parent and a child relationship in the information, but also aunts, uncles. There's a real story to be told there. And we want to make sure that the patient has that capability. Now, a patient can't look at their mother's medical information without the mother giving them permission. But once that happens, we want to make that available. We want to set probability of diseases based upon that information and assist the physicians in looking for preventative care and being able to set wellness programs based upon family medical histories.
Now, is there any reluctance on the part of a physician from participating in this type of activity?
Yeah, we actually have had some physicians who have been concerned about utilizing the information and how it may take up some of the time that they have with the patient. But we're looking at making sure that we give the physician a summary so that they very quickly can look at an image of an individual and see the summarized medical diagnostic events that have occurred, things like allergies, and we drive those around the body systems that medical providers certainly understand. So we want to give them summaries so that they quickly get to the information. We believe that by doing that, we'll get medical providers more active and enjoying the use of technology instead of just relying on manual documents.
That's terrific. We've talked about putting together a medical panel to try to address their concerns, physicians and other people, and I think that will be very beneficial. So they understand exactly what you have, how it will benefit them as well as their patients, and I think that is really an outstanding.
Yes, we are very interested in partnering with medical providers, making sure that we bring the right information and we present it in the right light. We want to make sure that they're on board.
Well, today we have talked about this technology, what it does for you as a patient, and what it can do for your physician as well as for medical insurers and other life insurance carriers as well.
Yes.
And if you have further questions about this technology, how it would apply to you or how it would benefit you or your business, you should get in touch with Tammy Jamieson, and the information to get to her is on the end of this program, and we look forward to hearing from you in the future. Tammy, thank you so much for joining us today.
Well, thank you for this opportunity. I've enjoyed it. Thank you.